From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello, everyone. I'm Genaye Channel with my co-host, Dr. Philip Katz, the chairman of the Gastroenterology Department here at Einstein Healthcare Network. And this is the Gastroenterology Show. Our topic is how to take better care of your stomach. So let's get right to the questions which stem from our viewers. Doctor, if you can explain the role of diet and nutrition with digestive health.
So, Genaye, this is a really complex topic because there's a lot of mystery around diet. But it is very clear that what we eat has an effect on how we feel, particularly in the GI tract. Some people have to eat small meals to feel well. Some people can eat whatever they want. Some people have to restrict certain food types like carbohydrates or fats or proteins. But it's variable in how it can affect the GI tract.
So do you recommend someone who may be having some GI tract issues working with someone who specializes in nutrition, or do you think they could do it on their own?
You know, that's also a very tricky question. I mean, in general, the symptoms that we worry about for diet relate to reflux disease or GERD, some stomach problems that some people call indigestion, which we know is a problem called dyspepsia. Some people just call it an irritated stomach. Irritable bowel syndrome, constipation, and gas. You know, the bottom line is that people should try on their own, vary the size of their meals, change the frequency of their meals, eat a little more slowly. That's a good start on their own. But if people are having GI distress that is not managed simply by their doctor, then I think it always helps to seek aid of a professional, a dietitian, a nutritionist, or your physician or other caregiver.
So how should people listen to their bodies if they're eating the wrong foods?
The logical answer is that if you clearly find that spicy foods aggravate your stomach, then you're going to have to do something about the spicy foods.
Right.
If you know when you eat late at night that you get heartburn, then you have to adjust accordingly. Some people are clearly lactose or milk sugar intolerant, and then when they eat cheesecake or when they drink milk, they're going to get gas and they're going to get loose bowel movements or diarrhea. Those things you're going to stay away from.
So does a person's diet affect certain diseases?
It's a great question, Genaye. You know, the clear answer is yes. It's just not clear how. You know, we know that certain foods can exacerbate reflux. Sometimes the speed of eating can exacerbate reflux. It's always been suggested that high-fat meals can exacerbate gallbladder disease, for example.
Yes.
And there are multiple thoughts about diet and irritable bowel syndrome. Certain types of carbohydrates people may be intolerant of, milks and milk sugars. Some people do better with certain fats as opposed to other fats. So it gets a little bit complicated. And then there are some risk factors perhaps for colon cancer related to diet and maybe some other GI diseases. So it's a little bit tricky, but the right answer is yes.
Okay.
And if you have one of these problems, or if you find that you're getting symptoms after you eat, it's a good time to get a checkup from your primary care provider and see if that diet needs to be modified.
So why is it important to listen to your body and then follow up with the caregiver?
Well, the short answer is that you're going to feel better if you don't have all these symptoms.
Right.
And when they're chronic, they're going to make you tired, they're going to make you irritable, you're not going to sleep as well at night. You're going to do some socially unacceptable things like belch and pass other kinds of gas.
Right.
And you're going to feel bad in the tongue.
Mm-hmm.
So that's the main reason. It's a way of having a better quality of life.
So what is the correlation between obesity and digestive health?
Well, that's the age-old question. I mean, people who are overweight are predisposed to many illnesses. In the GI tract, there is a link between obesity and colon cancer. There's a link between obesity and reflux disease, and then ultimately esophageal cancer. And those are the big, ugly things.
Right.
They can affect, multiple other organs. That being overweight is just a general health hazard across the board. Not to mention that most people, my perception is, who are overweight don't feel as well as when you are at ideal body weight. You don't have the same energy. You don't have the same strength.
Well, Dr. Katz, thank you so much for sharing this great information.
Thank you for having me.
You're welcome. Be sure to watch more episodes on this topic and other issues of interest to all patients here on the Gastroenterology Show. We will see you next time.
From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.